Good evening. Welcome to this webinar organized by the Council of Somali Organizations in COVID-19 Vaccine, presented by my colleague Abdelhafid Jama and myself, Amal Ahmed. The aim of this webinar is to explain and answer all the questions and concerns the Somali community have about the COVID-19 vaccine. So, let's welcome our guest speakers. We have Dr. Gwenta Carey, a senior research associate with the Global Health Governance, helping supervise researchers and students working on health and disparities. She holds a PhD in medical sociology from the Texas A&M University. We have also Dr. Sharifat Mohamed Kamal, a senior clinical pharmacist with a management experience in the community and the NHS, was elected as a vice president of the BMA Pharmacist Network. And last but not least, we have Dr. Samira Hassan, a Somali GP and a family physician from Leicester and a vice president of the British Somali Medical Association. She has an interest in medical education of global health. So, my colleague Abdelhafid Jama will do the translations in Somali. And first, we will going to start with our first guest speaker, Dr. Gwenta Carey. Dr. Gwenta Carey, welcome to this webinar, and thank you so much for accepting these invitations. And there's one question. I know that you have a slide that you would like to share it with us, but there is one question as well. Many people, especially people from the Black communities, and ask is the vaccine safe, and why there is a hesitations about the vaccine, especially like, as you know, like during this pandemic, and the ethnic minority people, they were the one who most affected. And there was a recent research came out saying like up to 72 people and from the Black community are unlikely to have a jab. And please welcome.
Yes, well, thank you very much for having me here tonight. And what I will do is, let's see, I will share my slides, and it kind of goes through the question that you actually just asked me. And let's see what we can do here.
Thank you.
All right. Yeah, so just real quickly, we're going to look at the impact of COVID-19 on Black people, and then we're going to go into this question about the vaccine. And if you look at this data, this is the data from the Office of National Statistics, and it shows males and females. Black Africans, as you can see, have the highest rate of mortality from COVID-19, the highest rate of death from COVID-19. And this has been linked to living conditions. The ethnic minorities are overrepresented in living in deprived areas that had the highest rates of COVID-19 incidents. And Black people are more likely to live in deprived areas compared to their white counterparts. And one of the things that came out of the data showed that during lockdown, Black families had 4 times the less access to green spaces than their white counterparts, which created a strain on the family as a whole. Now, this is the age standardized mortality rates, again, showing that those in more deprived areas were more susceptible to dying from COVID-19. And occupations play a huge role. So you talk about the jobs that ethnic minorities have, taxi and cab drivers, food service workers, those who are working within the NHS were overrepresented in those front-facing jobs and had higher rates of death from COVID-19. And the data really shows that racial ethnic minorities were overexposed and underprotected. And when we come to talk about the vaccine, as you said, the survey published earlier, this was in January, and it showed that 72% of Black Britons said they were unlikely to be vaccinated against COVID-19 virus. And so when you try to dig in to understand why this hesitation or doubt comes into mind, you go back to the report that came out in November 2020 that showed over 60% of Black people in the UK felt that their health was not equally protected by the NHS compared to their white counterparts. Now, this is something that is historical. It's not new that, racial and ethnic minorities not trusting the government. It's due to the lack of care and treatment that they've had. And what COVID-19 has shown is that, again, these populations are overexposed. So they're overrepresented in service jobs. They didn't have the protection, the proper PPE they needed to not be infected by the virus. And they were also not able to stay at home. So when other people were able to stay at home, they were more likely to have to continue to go to work, less access to paid time off. And so when the survey came out, it was just recent ONS data that showed about vaccine uptake. A lot of the concerns were not knowing the side effects, possible side effects of the vaccine, and not knowing the long-term effects. And Black populations are concerned with these side effects largely because if they do get sick and they have to take time off work and they don't have access to paid time off, that just means just less money that they have to take care of their family. So those are some of the concerns that came out of the data. And I'm sure we'll have a lot more questions around that, but that's kind of the history. So if Black people in the UK feel that they're not protected prior to COVID-19, they definitely don't feel protected in the space of COVID-19. And now we're trying to pass out this vaccine and we're wondering why people are not, running to it. Even though Black people are dying at a higher rate, why are they not running to get this protection? It's largely, there needs more information needs to be shared about it, as well as a building of trust in the community. Yep. And I will stop there so I don't go over my time.
That's amazing. Thank you so much. Very informative. And dear Mr. Chama, would you like to translate this bit a bit in Somali, please?
Amal, thank you very much. waxaan idinku soo dhaweynaynaa meetingkan ama kulankan webinarka ay qabanqaabiyeen Council of Somali Organizations, dalada isku taga dadka Soomaaliyeed, waa dalada ugu ballaaran iskuna keentay communitiyada dalkan UK ah kana mid ah communitiyada shaqooyinka badan u haya organizationada shaqooyinka badan u haya communitiyada Soomaaliyeed. halkan waxaan isugu nimid si laydinkaga qanciyo bulshada Soomaaliyeed daawooyinkan iyo tallaalada la qaadanaya iyo dhibaatada uu ku hayo xanuunkan COVID-19 gaar ahaan dadka laga tiro badan yahay. Dhakhtarada ayaa waxay si fiican u sheegtay shaacana ka qaaday inay jiraan waxyaalo fara badan oo dadka madow anagu aanu ka mid nahay Soomaali haddaan nahay ay ka cabanayaan ama dhibaatada iyo walwalka ay ka qabaan. waxaa ka mid ah jirin ayagoo degan guryo maaragtay ciriiri ku aan ku filnayn shaqooyinka ay ka shaqeeyaan 75% weliba waxaa la yidhi walwal ayay ka qabaan inay tallaalkaas qaataan. waxaa kale oo daraasad la sameeyey lagu eegay bay tiri lagu xaqiijiyey in 60% dadka madmadow aysan kalsooni fara badan aysan ku qabanin. daraasadaas ayaa waxaa la sameeyey November iminkana soo dhaaftay 2020 arrimahaas iyo macluumaad fara badan oo dadka madowga ee Soomaalidu ay ka mid tahay iyo kuwa laga tiro badan yahay ay u baahan yihiin baa jirta. sidoo kale waxaa jirta information la'aan dhab ah oo dadku wararka waxay ka qaadanayaan meelo aan sugnayn iyo dadka dhakhaatiirta oo ku shaqeeya. haddaan si kale idin iraahdo farin ku dirku dhakhtarku uma noqonayo ka qaado talada dhakhaatiirta rabbina tala saara. Amal waa adiga.
Thank you so much, Mr. Chama. And now we're going to go to Dr. Sharifat Mohamed. Dr. Sharifat, can you tell us exactly more about the vaccine and how safe it is? We can't hear you. You're on mute.
Hello, everyone. Thank you for having me today. I know we've had so many WhatsApp messages. We have read so many things on social media, and we've seen so many things, and we still have some of this lack of trust in the vaccine. I mean, what we have seen to date now is about the question of what does the vaccine contains, or are we safe, and how safe is the vaccine? The researchers, scientists, they've carried out a lot of trials on the vaccines, and it's been declared safe, and the rate of the safety is high and is highly effective. And one of the things that people that we've answered questions for is about vaccine changing the DNA. And I mean, we've found that is likely not to change any DNA because the content of the vaccines are just there to protect and promote our immunity. At the same time, people are scared of side effects. And most of the side effects that we can see and we've heard, I mean, that normally comes up is just the pain at the site of the injection. Some people generally feel pain all over the body, just like normal vaccine that we normally have. And we've not really had things that are really serious. Then at the vaccine center, I mean, people that have already gone for the vaccines, we've seen that people have come in and people have gone out. There's going to be information for you. There's going to be people there to answer your questions. And even you're even allowed to sit down for a couple of minutes before you go out so that we know that you haven't had any reaction to the vaccines as well. And people have also asked questions about people that are pregnant and people that are breastfeeding. Are they happy to take the vaccines or not? And these vaccines for people that are breastfeeding is okay, but we don't have data enough for people that are pregnant. So they will ask you when you get to the vaccine center, are you planning to get pregnant or are you already pregnant? Then another thing that we've seen people asking about the vaccine is the type of the vaccines, which one is better than the other. I would say that, I mean, the immunity, according to the research that we have with us at the moment, they're both vaccines and they are equally good for, whichever is available with your center is equally good. Depending, what it matters to us as pharmacists is the storage conditions and the time, the way we manage it after you've had the vaccines. For example, like if you have the AstraZeneca vaccines, you can actually go home straightforward without having to look after you because it's just a bit stable. But if you have the Pfizer vaccine, we will say you sit down for about 15 minutes before you can go ahead to wherever you're going. So, I mean, they are equally safe. And there's a lot of information from the people that is given the vaccine when you get to the vaccine center, that if you need more information, they'll be able to ask you. One other thing that we wanted people to really look into is getting the facts and the information from sources like this. When you have people that are experts, people that know exactly what is happening with the vaccine, that know the side effects, people that have worked within the vaccination center. So that's the place we should seek our information from, rather from WhatsApp or social media. So another thing about the old people, I mean, there's a lot of things coming up to us about elderly people. Some people have had it and they have serious side effects, or some people have had it. But what we're saying is this: people that have had anaphylaxis in the past, we normally ask this before you get the vaccines. You have to tell them that, oh, I'm allergic to this, I'm allergic to that, I've had anaphylaxis in the past, and you will not be given the vaccines. So the vaccine is as safe as any other vaccine that we have had in the past. And the only thing we need to just think about is our own health. How can we support ourselves and our community to continue to let them understand the fact that this is safe for us and it's going to protect us and increase our immunity. Thank you.
Thank you so much, and Dr. Sharifat. So, Mr. Chama, would you like to come forward and translate that? Please go ahead.
Thank you, Amal. waad maqlayseen waxa la weydiiyey su'aal muhiima oo dadku waa in badan isweydiinayaan. Su'aashaas ayaa waxay tahay tallaalkan qaadashadiisu ma mid safe oo dhibaato ka imaan mise waa mid dhibaato ka imaanayso. waxay tiri marka horeysa waxaanu arkaynay in ay dadku fartiimo isugu dirayaan WhatsApp-ka iyo social media fartiimahaas oo aan ahayn kuwa sugan oo xaqiiqo ku salaysan ee ku tirikuteen iyo wararka suuqa lagu hayo iyo fadhi ku dirarka iyo xaafadaha gudaha lagu qaybsado. arrimahaas iska joojiya, dhakhaatiirtana ka qaata talada bay tiri. daawadana waa safe qaadashadeedu ilaa haatan wax dhibaato ay keentay ma jirto, laakiin haddaad daawo hore u qaadatay fadlan dhakhtarkaaga u sheeg daawatan ka duwan si aad haddaan xasaasiyad qabtid ama xanuuno kale aad qabtay u sheegtay si lagula taliyo markaana lagu siiyo daawada adiga baahidaada gaarka ku jaango-an. sidoo kale waxay tiri daawadaanu marnaba suurtagal maaha inay beddesho hiddasidahaaga oo hadda maalan anigu nin Soomaaliyaan ahay 100 sano kadib 25 sano kadib 50 sano kadib inay carruurteedu markaa dhalaan qof aan hiddihii Soomaalida aan wadanin ama DNA-gi wadanin oo maalan indhuhu ay madow buluug yihiin oo kale ama timo ay cad yihiin oo kale, waxaas ma jiraan. doofaar kuma jiro, khamri kuma jirto, waa daawo safe ah fadlan qaata oo familkiina iyo reerkiina daawadaas kula tacaala ilaahayna tala saartay. Amal soo dhawo.
Thank you so much, Abdel Hafid Jama. So now we will gonna go to Dr. Samira Hassan. Please come forward.
Hi, Assalamu alaikum, everybody. Assalamu alaikum, Damban, Umad al-Somali, Merksta Choktan. I think I'll do my introduction both in English and Somali. So in English, my name is Dr. Samira Hassan, and I am a GP by background, a family physician, and I'm based in the city of Leicester in the UK, and I'm obviously the background of the Somali community. And a lot of the work I've been doing lately has been related to COVID vaccine awareness. Prior to that, I've done a lot of awareness videos with regards to the pandemic. My interests are in medical education, global health, and I'm also the palliative care lead for my practice. And I'm also one of the committee members and one of the founding members of an organization called the British Somali Medical Association, where we deal with some of this work, particularly with regards to community outreach, health awareness, and obviously particularly highlight the issues of COVID-19 and its vaccines. haddaan af Soomaaliya ku turjubaano waxaa la yiraahdaa Dr. Samira Hassan, waxaan ahay dhakhtarad GP ama daryeelka asaasiga ka shaqeysa magaalada Leicester wadanka UK. waxaana aad uga shaqeynayay sanadkii dhaweyd COVID-19 saameyntiisa waliba khaas ahaan bulshadeena iyo intii ka dambeysay vaccinationka oo talaalku soo baxay saameyntiisa iyo cilmigiisa iyo wararkiisa saxda ah aan rabay inaan dadkayga u bixiyo. waxaan ka mid ahay urur la yiraahdo British Somali Medical Association oo ah ururka dhalinyarada ama dhakhaatiirta Soomaaliyeed wadanka UK iyo ardayda medical studentska oo ku jira jaamacadaheena wadanka UK. shaqadeenu ay ka mid tahay inaan ummadda Soomaaliyeed khaas ahaan inaan wacyi gelino, warbixino siino waxyaabaha caafimaadkooda ku saabsan ama xanuunada cudurrada badankood ku saabsan. laakiinse khaas ahaan aad waxaan uga shaqeynaynay intii COVID-19 pandemic soo baxay ama uu talaalku soo baxay warbixintiisa.
Thank you so much, Dr. Samira. It seems like we are on the right track. We will open the questions for the public at 6:40, so still we've got time to have a bit of discussions. I think one of the questions as well many people are asking and worried about is the variants. As you know, there are so many variants out there. Like, we've got the Ken variant, we've got the South African variant, and people are questioning with the vaccine going to work with this variant and for how long is going to last. Maybe any one of you could come up and answer these questions. Would you like to go ahead, Dr. Sharifat Kamal or Dr. Samira?
I'm happy to do that. Do you want me to do so?
Go ahead, Dr. Samira, please.
Yeah, so if I'm to answer this in English, I think the most important thing to understand is that viruses, which coronavirus is one of, generally mutate, and it's not something new and something that's always existed since the beginning of a viral's life, basically. And that mutation generally means that there will be some mistakes in the genetic code in the DNA every time they replicate. These mistakes sometimes mean nothing because it doesn't fundamentally change the virus's capabilities, but sometimes these mutations or changes in their own DNA will mean that they're more likely to be infective, more likely to transmit easily, and more likely to cause a heavy burden of disease. And of course, as time went on and as the pandemic went on, we did expect to see several thousands of different variants, most of which have never made the headlines, but the ones that have made the headlines, like the Kent variant, the South African variant, the Brazilian variant, are doing so because they've been found to be much more transmissible. So the fundamental knowledge is that they're very much basically the same coronavirus. They haven't changed fundamentally, but there are changes in their DNA, which means that there are tiny changes in proteins of their spike proteins. So there's those little spikes on top of the virus. Within it, it's made of multiple protein building blocks. So these genetic changes in the variants means that there are changes within some parts of the spike protein, which is the lock and key that they use to enter human cells and obviously infect. And they use the human cells to replicate themselves, to build themselves up again, and to be able to to infect other host cells. So these are the changes that means that they're more transmissible. But the important thing to remember, I think, for the general public, I know we're all very worried about the variants. The most important thing to remember is that the vaccines that we currently have are highly effective against most, and I mean the overwhelming majority of the coronavirus variants we have in the UK. There is some also evidence that it is having some efficacy against the South African variant and the Brazilian variants. But of course, we don't fully know the extent of that yet. Work is still being underway to look into that. There is some efficacy, but not as much as it is to the variants that we had initially when the vaccines were being developed. Nevertheless, some protection is better than nothing. The other thing to remember is because these are genetically engineered vaccines, whether it's DNA, whether it's mRNA, we do thankfully have the capability to tweak these vaccines to be able to highlight or particularly target these new variants. And of course, that may mean in the future that we have booster vaccines or yearly vaccines. We don't know yet. Research is still underway, but that capability is still there. We are very much very advanced in the sense that we are able to tweak them to make sure that it closely codes the genetic variants that were coming up. And alhamdulillah, in the UK, we have huge genomic processing capabilities and analyzing capabilities. So that's the most important thing. If you want me to translate that quickly into Somali.
Yeah, that would be great, please. Just like I would like to announce that the polling is open for the attendees. So please feel free to fill the polling about vaccine myth and posting. I mean, go ahead, please, Dr. Samira, and do the translations in Somali.
No problem. marka su'aasha la weydiiyey waxay ku saabsanayd waa tii la yiri waxa soo baxay noocyo cusub oo coronavirus oo aynu naqaan variants macnihiisa ay tahay wuu ka yara bedelan yahay coronaviruskii berigii hore dilaacay sanadkii hore marka maadaama ay noocyada cusub jiraan la leeyahay way ka faafitaan badan yihiin tallaaladu wax ma tarayaan marka waxaan ka jawaabay oo aan ku sheegay tallaaladu horta markii si loo eego markii ugu horeysa muhiimaddu waxa weeye in la fahmo noocyada coronaviruskan ingiriiska ku haysano UK oo dhan ku haysano tallaalada maanta haysano saddexdii la fasaxay Pfizer iyo Moderna iyo Oxford AstraZeneca aad bi shaqadooda u fiican tahay markii ku saabsan tahay coronavirusyada noocyada aan ingiriiska maanta ku haysano ama UK oo dhan ku haysano so most yani dadka badankood adigu 90% ku dhawaad dadka coronavirus qaba ama looga baqayo inay coronavirus qaadaan tallaalada aynu haysano way ka celinayaan insha Allah inay aad ugu sii xanuunsadaan ama dhakhtarka loo dhigo ama ay u dhintaan 95% iyo wixii ka badan baynu rajaynaynaa insha Allah noocyada cusub oo lagu sheegayo South African variant ama Brazilian variant ama Kent variant oo ka soo baxday magaalo Kent la yiraahdo Ingiriiska ah waxay ku kala duwan yihiin coronaviruskii markii ugu horeysan aragnay sanadkii hore waa wax yar oo ah qaybta spike proteinka lagu sheegayo oo ka taagtaagan coronavirus kasta qaybtaas ayaa isbedelaysa wax yar coronaviruskii oo dhan wax cusub ma noqonayo waa un viruskii laakiin wax yar baa isbedelmaya waana wax ay virusyadu horta sidoodaba ay sameeyaan markay tarmaan waliba xoog u faafaan mar walba markay tarmayaan waxa isbedelaya wax yar qayb yar oo kamid ah DNA-ga marmar bay isbiirsadaan isbedelaadaas ay noqoto isbedel yani weyn oo viruskii shaqadiisa yara bedeli karta marka variantska sida daraadid ay soo baxeen laakiin spike protein kun baa ka yara bedelan spike protein kaasna waxay keenaysaa bedelaadiisa inuu faafitaankiisa 70% ka badan yahay coronaviruskan ogeyn sanadkii hore iyo inuu maaragtay dad badan sii gaari karo laakiin si waa un coronaviruskii sidii unbu qofkii u dhaawacaya ama ugu xanuunsanaya sidii unbu qofku maaragtay u saameynaya coronaviruskii hore marka waxa muhiim ah marka in la fahmo maadaama inkastay variantskaas jiraan tallaaladan maanta haysano badankood way ku shaqeynayaan coronavirusyadan haysano midda labaad waxaynu haysanaa haddii ingiriiska joogno capability maaragtay technology iyo horumar technology science yahanadii ay bedeli karaan vaccinationka haddii loo baahan yahay wax yarun baa laga bedelayaa si ay ula socdaan variantska cusub si ay uga shaqeeyaan variantska cusub haddii loo baahdo laga yaabo in mustaqbalka la yiraahdo sanad walba maaragtay tallaal cusub in la qaato si looga hortago noocyada cusub soo baxa Allahu a'lam laakiin alxamdulillah waxaanu haysanaa technology lagu bedeli lahaa vaccinationka haddii loo baahan yahay marka waxaan leeyahay ummadda Soomaaliyeed meel kasta ay joogaan aad haga warwarinina noocyada cusub waxa jiraaba waa arki doonaa waa xoog baa loola socdaa laakiin si tallaaladan aad bay uga shaqeynayaan oo wax ku tarayaan oo difaacaga kicinayaan xagga noocyada maanta Ingiriiska ku wareeg
Thank you so much for your explanations, and Dr. Samira. Dr. Sharifat, would you like to add something quickly? And before we open the questions, also I would like to ask Dr. Gonta one last question before we go to the questions and answer. Would you like to add some things, Dr. Sharifat?
Yes, please. I just want to add something to what Dr. Samira just said. It's just about the vaccines and the vaccinations as well. What we need to know is the fact that what the vaccine does is just to, improve and develop, improve our immunity within the system. So it's not coming into our system to change any DNA. It's not coming to our system to affect the fertility, and it's not even coming into our system to affect anything that we're doing naturally. So it's just coming to the system to support us so that whenever the virus attack, the body will already be immune to the system and to the attack. And that's why we have to have the vaccines.
Thank you so much. And Dr. Gwenita, and one last questions, and just to make it very quick before we go to the questions and answers for the public. And there is a report shows that 22 million people in the UK have already have at least received the first dosage of the coronavirus. Does that mean that we are on the right track? And what the government and us can do to increase the confidence on the vaccine?
Yes, I think we're definitely on the right track. With 22 million people vaccinated, we're definitely moving in the right direction. And the data shows that the vaccine definitely reduces the risk of death. So that's why it's really important to drive home the safety of the vaccine and really, kind of ease people's minds in terms of their concerns around the vaccine. And I think something that we could do is kind of work hand in hand. These events are really important because now, you're getting access to specialists. And so the community can ask the questions that they have. And a lot of times it's really just questions that they have that's making them hesitant or, cautious about moving forth with it. I think it's more of a community effort with the doctors working with the community to address their concerns. And I think that, I push that it's more than just vaccines. I feel like communities have been missing and lacking resources for years, and now we're showing up at the door saying, take this vaccine. And I think so we need to address more than just the vaccine. I think the vaccine is immediately something that we need to deal with right now, but we also need to address the racial and ethnic inequalities that we have in terms of education, in terms of access to quality care, in terms of better living conditions all the way around.
Amazing. Thank you so much for your answer. And Abdulhamid, would you like to translate both of them briefly? Thank you so much.
Right, mahadsanid. Dr. Sharifa ayaa waxay tiri waxaan isku dayayaa inaan hadaladii Dr. Samira aan qaar ka soo qaato aan la ta'kiidiyo ama adkeeyo bay tiri talaalkan waxa uu salka ku hayaa bay tiri difaaca jirkaaga ayuu kordhinayaa oo markuu viruskaas soo galo waxaad haysataa wax aad isku difaacdid oo jirkaaga ku jira marka fadlan qaata. Dhakhtarada kale ayaa sidoo kale waxaa la weydiiyey talaal baa la helay xanuunkan dadka aad ku dhibay talaalkan iminka dadkii maadaama talaal la helay ma dariiqii iyo dhabbihii saxda ahaa baan ku taaganahay ma la oran karaa haabay ku jawaabtay waxayna tiri dhabbadii saxdayd baan ku taaganahay waana wax lagu farxo inaanu aragno 22 milyan iyo dad ka badan in ay talaalka qaateen in badan bay communitida laga tira badan yahay annagu aanu ka mid nahay ay tabanayeen cadaalad darro iyo dhibaato haatan daawadii oo socotaa guryahooda albaabada kusoo garaacday qaarta oo ka faa'iidaysta ayay leedahay laakiin tani waa mid keliya ma ahan waxyaalo kale oo fara badan oo xajir in la adrees gareeyo u baahan hadday ahaan lahayd dhinaca sinaanta iyo cadaaladda hadday ahaan lahayd waxbarashada dadka laga tira badan yahay oo meeshii la rabay aan joogin iyo waxyaalaha la midka dariiqii dhabtaha baan ku taaganahay waana ku faraxsanahay bay ku leedahay soo dhawaabal mar kale.
Amazing. Thank you so much, Walal Abdulhafid. So, and I think now we can go to the questions and answers for the public. And I think one of the first questions I received, and there was this anonymous identity saying, like, they have, she or he received their vaccinations and yesterday, and they are feeling unwell with the temperatures and body ache. Is that normal? Would that feeling goes away? Dr. Samira, would you like to answer this question? Because I'm sure there's a lot of answers. There's a lot of questions when it comes to the feeling and how you feel after the vaccine when you take the jab.
100%. So with regards to answering that question, it is very common to expect side effects from the vaccine. In a lot of people, although there are many who have not had any side effects whatsoever. But the most common side effects are the side effects that include headaches, fever, body aches and pains, muscle aches and pains, typical flu-like symptoms where you just feel slightly unwell or tired or lethargy. I had those symptoms when I first had my vaccine. Thankfully, they settled in 24 hours. Some people, it takes 2 to 3 days, but it can take up to a week. And anytime it goes beyond a week, you're advised to speak to your GP in case there's something else underlying going on. So for example, if you had the vaccine, but you happen to pick up the flu or you have a chest infection, of course, these symptoms won't just go away. So it's important to make sure you speak to your GP if they are severe or they last more than a week. But coming back to why these side effects happen in the first place, it's because very commonly, you have to understand that the way the vaccine works, as Sharifa mentioned, is that they introduce a genetic material that produces the spike protein. Your body believes that the spike protein being there means that it actually has coronavirus attacking it. And therefore, your immune system will act as if there's coronavirus in the system. And how does the immune system work? You develop a fever because that's one of the ways your body tries to kill the bugs. You will have muscle aches and pains because of the fever, and that's a natural byproduct of fever. You may have headaches as well related to that. And you may feel unwell and tired because a lot of your resources and energy is going towards building your immune response. So the fact that you're having these side effects is actually a sign that your immune system is actually working. And it's very common to have these. We tend to have these when you have flu vaccines. A lot of young children, when they have their vaccinations, immunizations, the nurse will always advise you to give them paracetamol and just look after them and give them a little bit of tender loving care because they will feel unwell maybe for the first few days. Again, the COVID vaccine is very similar. But despite these side effects, if they're quite severe or you are concerned about them or they last for more than 7 days, it's really, really important to speak to your GP about them in case it's something else going on. But they should settle within a few days for the vast majority of people.
Thank you so much. Would you like to translate this in Somali?
Oh, yes. No, 100%. So سؤال ويديو waxay ahayd qof baa tallaalkeeda qaadatay waxay tiri shalay baan qaatay maantana weli xumad baa haysaa waxaan dareemayaa inaan xanuunsanahay lafa xanuun iyo lafa garaac baan leeyahay ma laga yaabaa inay astaamahaas iga ba'aan muddo yar kadib marka anigu waxaan ugu jawaabay astaamaha qofku dareemi karo markuu tallaalka qaato way ka mid tahay astaamahay sheegtay waxaa ka mid ah madax xanuun xumad jir xanuun lafa xanuun ama lafa garaac daal iyo qofku inuu dareemo inuu maaragtay yara xanuunsan yahay astaamahaas sababta ay qofku u yeelan karo markuu tallaalka qaato waxa weeyaan tallaalka shaqadiisaaba ah inuu jidhkaaga dareensiiyo ama khiyaanayo oo jidhkaaga moodsiiyo inuu coronaviruskii runta ahayd soo weeraray coronavirus lagugu duri maayo laakiinse jidhka la moodsiinaya ama difaacaga la moodsiinaya inuu coronaviruskii dhabta ahaa jidhkaaga soo galay marka maadaama uu jidhkaagu waxa dareemayo difaacagii baa kacaya oo markaad xumad dareemaysid waa difaacagii oo shaqaynaya markaad lafa garaac dareemaysid ama jir xanuun dareemaysid waxa weeyaan xumaddaa keenaysa madax xanuunka iyo daalkana qofku markuu fluuga qabo ama uu xanuunsanayo difaaciisa keenay kartaa oo waxay ka mid tahay waxyaabaha aad dareemi kartid markuu jidhkaagu ama difaacaagu shaqaynayo marka sida aynu u qaadan jirnay tallaaladii hore ilmaha yar marka tallaalka la siinayo ama flu vaccinationka markaad ama tallaalka fluga markaad qaadanaysid qofku waxa laga yaabaa inuu dareemo jir xanuun iyo xumad iyo madax xanuun iyo lafa garaac sida daraaddeed ayo covid vaccinationka ama tallaalka covid isna kugu beeri karaa laakiinse ogow dadka badankood ayaamo gudaheeda iyo kaga ba'a waana astaamo sahlan marka haddaad isku aragtid astaamahaas oo aad ku dhibayo ama aad ugu xanuunsanaysid ama aad dareentid ilaa wiig kadib inaanu kaa bi'in ama kaaga sii daray fadlan GP-giina la hadla waayo waxaa dhici karta inuu ama xanuun kale kuu hoos maray ama aad wax kala qabtid wuxuu yahay in la ogaado baa loo baahan yahay maadaama aad astaamihii aad kugu xun yahay ama uu 7 casho gudaheed kaaga tegi waayo marka insha Allah la socda.
Thank you very much, Dr. and Samira. I have actually 2 questions from Susie Miller. The first question was, I think at the beginning of the webinar when Dr. Kari, she was speaking, and I think Susie, she would like to know if there is like figures available around, you know, the mental health that affects, you know, and the BME people when it comes to this issue.
There are current studies going on right now that looking at mental health of BME communities and COVID-19. The data that's recently came out showed that among Pakistani and Bangladeshi men, there was a deterioration in mental health during the first wave of COVID-19. A lot of the deterioration in COVID-19, deterioration of mental health has been linked to job loss. So there's like depression, dealing with job loss, and and being isolated and losing hours of work. The data that came out showed that Black people actually had the highest rate of unemployment and the highest chances of reduced hours in relation to COVID-19 lockdown.
Okay, thank you so much. I hope that answered your questions. And Susie, also Susie, she's got another questions, but I think this questions, Dr. Samira, she can answer it because it's mainly like, a health and issues. She's saying like some people with pre-existing conditions have been told that some vaccines have been known to react badly for others with the same conditions. And is there enough information for the community members to know more about, which vaccines will gonna work better with their conditions? Is there some sort of test they can do? Because, some people, they say, there is research saying like, some people do the test dependent on their conditions. It could help them to, to save their life and things it doesn't have implications. Also, like, she was asking as well if there is a better way of providing, the informations to the people. And I hope I understood, Suzanne Miller from Somali Mental Health and at Sheffield.
That's a really good question. And I think that's a question that has often plagued a lot of people, and I get that quite a lot. With regards to pre-existing medical conditions, there's obviously several different thousand types, and it varies from really severe conditions such as cancer treatments or people whose immune systems have been wiped out because of immunosuppressive therapy, people with chronic or severe kidney disease, people who are transplant patients, those who we consider extremely clinically vulnerable, some of whom have been shielding for a long time. It varies from that all the way through to regular asthma, everyday diabetes that's well controlled, people with previous conditions, heart disease and kidney disease that is stable and managed. So with regards to the vaccine, so far we've been giving up the Pfizer and Oxford AstraZeneca. There is no delineation and there is no separation with regards to which vaccine who gets. The different vaccines are available based on availability and supply. And we vaccinate our patients based on what is available on that day that you have your appointment, not because of the fact that you have certain medical conditions. There is no separation between the two. So both the Pfizer and the Oxford AstraZeneca clinical trials, when they were developing the vaccinations, have included and incorporated differences in age, ethnicities, and pre-existing comorbid conditions in their trials. So I have vaccinated people with both the Pfizer and Oxford AstraZeneca, varying from those who have severe cancer and are going on ongoing cancer treatment at the moment, through to young men or young women who have severe mental health issues or learning disabilities and are on treatment for it. There is no need to separate those two, and there is no specific test that would say that you need the Pfizer as opposed to Oxford AstraZeneca because of so-and-so medical condition. The only times we don't give people any of the vaccines at the moment is if you're pregnant and you're not in one of the eligible cohorts, such as those who are frontline facing pregnant women or women who are more likely to be exposed to COVID and have pre-existing health conditions. So the pregnant women in general are not given the vaccine. Young people who are under the age of 16 are not given the vaccine. Those who have had very recent COVID-19, confirmed COVID within the last 4 weeks, and those who are known to have severe anaphylaxis, and I mean the type of anaphylaxis where you end up in hospital, to any of the possible ingredients of any of the vaccines. And if there's any question, we make sure that they are reviewed by the immunologist before we give them the vaccine. Those are the only delineations. There is no separation. And there is no evidence at the moment that any of the vaccines are more at risk for anybody because of their age or any particular medical condition. I hope that answers the question.
Amazing, thank you so much. And yes, it did. Do you want to say it in Somali as well, or shall we?
Yeah,
I could ask Abdul Hafid to do it just to give you a break.
No, I don't mind. No, I don't mind actually. So actually weydiiyey waxaa la weydiiyey dadka qaarkood waxay qabaan xanuuna ama xaalada hore oo cudurrada qaarkood sida diabetes, wadna xanuun, kelyo xanuun. Marka dadkaas dadka had iyo jeer weydiiyaan maadaama aan xanuunka caynkaa qabo ma u baahanahay talaal ka mid ah ama Oxford AstraZeneca ama Pfizer yamaan qaataa yamaa u fiican xanuunkayga. Marka su-aasha kale ay weydiiso waxa weeyaan ma jirtaa test ama tijaabo la samayn karo oo qofka u sheegi karta maadaama uu xanuunka caynkaa qabo inuu tallaalka magacaa le qaadan karo marka su-aashaas waxaan uga jawaabay labada tallaalba ayaamahan ama bilihii dhoweyd oo dhan aan dadka siinaynay waa tallaalka Pfizer BioNTech iyo Oxford AstraZeneca labaduba waxaa la siiyaa nooc kasta dadka nooc kasta da'dooda ay tahay ama ay ethnicity-gooda ay tahay ama xanuunaday qabaan xanuunada way kala duwan yihiin dadka qaarkoodna aad bay u liitaan waa dadka wadnaha waa dadka kaliyaha loo bedelay waa dadka kansarka xun qaba oo haddeer u socota daawadii kansarka waa dadka aadka u xanuunsanaya oo waayeelka ah iyo waxaa jira dad maaragtay xanuuno qaba laakiin si sahlan oo haddeer control lagu hayo maadaama ay daawooyinkooda qaato sida sonkorta ama asmada iyo dad u dhaxayaba xanuunku nooc kasta ha ahaadee siduu doonaya ha u kala daraadee labada tallaal lama kala saarin oo lama oran tallaalkaas ama tallaalkaas u fiican xanuunka caynkaas waayo labada tallaal markii tijaabooyinkii la sameynayay sanadkii hore waxaa lagu tijaabiyey mid walba dhowr qof oo da' walba ay ku jirto aan dee carruurta ku jirin iyo dee dhowr qof oo dee noocyada ay yihiin qaarkood madow iyo qaarkood caddaan iyo dee nooc kasta ahaadeen iyo dadka xanuuno fara badan qaba oo xaaladaha caafimaad hore u qabay oo nooc kasta ah marka lama kala saarayo Pfizer iyo Oxford AstraZeneca markii laga hadlayo qofka xanuunkiisa ama da'diisa ama ciduu yahay bas kaliya waxaa la kala saaraa oo dee qofka aan la tallaalin hadduu COVID-19 xanuunka laga helay 4 wiig gudaheed يعني هذه 4 wiig gudaheed laga helay COVID-19 ama aad positive test qabtay laguma siinayo tallaalka ilaa uu 4 wiig muddadii u dhaafo laguma siinayo tallaalka haddaa tahay qof uur leh oo aan u baahnayn oo baahi dheeraada u qabin sidii dumarka maaragtay uur kale oo safka hore ku jira ama dumarka xaaladaha hore u qabay ama aad tahay ilmo yarna laguma siinayo ama aad tahay qof ama aad tahay qof xaaladaha ama aad tahay qof xaaladda xun qaba oo la yiraahdo anaphylaxis oo ah xanuunka marka uu qofku allergy xun u gaaro oo naqsku ku dhago oo dhakhtarka la dhigo afarta kaliya ayaa il dheer si fiiro dheer lagu eegaya oo aan la siinayn tallaalka dadka kale oo dhan lama kala cadeynayo lama kala saarayo tallaalku nooc yahay umana baahna in
please Abdul Hafid go ahead and answer the questions answer in Somali translate in Somali thank you
وهاجاك سؤال waxay ahayd hadii ay aan qaato talaaladii qof walba talaalkii uu qaato xaaladdu ma waxay ku soo noqon doontaa sidii hore intaan xanuunkan uusan dunida saameynin sababta ayaa waxay ku jawaabtay hadii aanu talaalka wada qaadano waxa yaraanaya dadkii wax isku gudbinayay qof walbana waxa uu haystaa difaac uu isaga dhigo xanuunkaas inuu saameeyo marka waa wax lagu farxo inaan talaalka la wada qaato si dadku markaas ay isan isugu gudbinin dabadeedna transmissionkii u yaraado halkaasna lagu soo afjaro marka talaalka la qaato hana la isdifaaca ehel iyo qaraabo
Thank you so much. And I have actually questions from Abu Bakr and Said saying that, you know, he's struggling to find any official COVID informations in Somali. And where do you think people can find the informations about, you know, the vaccine and what's happening, especially as we know, like, the Black community are one of the main communities are, affected from COVID. Is there places where there is this information is available?
Yeah, so I can answer that question. Okay. With regards to Somali based information, I think one of the biggest problems we've had at the start of not only the pandemic, but the vaccination program is that it's been very few and far between. But to answer your question, where can one get information? I know the gov.uk website. So if you go into coronavirus.gov/UK website, you will find different leaflets translated into several different languages, and Somali is one of them. There have been a lot of webinars, of course, where we discuss these issues. But I have also produced a YouTube video where I really go through in detail COVID-19, how it affects people, what happens when they end up in hospital, but also did a lot of Q&A and explained how the vaccine works and debunking some of his myths. So that particular video is on my YouTube channel called Dr. Sam's Health Chat. But with regards to leaflets, there's a lot of written information online from the government websites like the gov.uk or coronavirus/gov.uk websites and the NHS websites. Do have some leaflets in Somali, but they're very few and far between, admittedly, and very patchy information. And unfortunately, they're not updated frequently.
That's incredible. Thank you so much, Dr. and Samira. Do we need...
If I can add on to that?
Yes, please. Yes, go ahead.
Yeah, sorry, I think, no, it's not. British Islamic Medical Association have produced some leaflets, and I think there's some of them that are in Somali.
Oh, amazing.
So what I do is, yes, I'll see if I can link them so that we can get to the organizers, and if that's going to help as well.
That would be great. I mean, maybe we can put it as well on the website. And
yeah, British Islamic Medical Association. I think they have it on the website as well.
Okay, that's incredible. And as well, there is a message from Shamaka Ismail. He is the manager at MAN, Mental Health in Sheffield, saying there is a survey being carried out by MAN Somali Mental Health in Sheffield, and it shows that the Somali community are ready now to take the jab, which is a very positive result. And I can see there is one question in Somali. Would you like Abdul Hafid to take that questions, please?
I can't see that question at all.
It's at the end. I think when you click on the ANA questions.
If you pass that question, then I'll start searching and finding, and then I'll read out.
Let me see. I think my Somali is quite bad, so it will be a bit embarrassing to try to read it to everyone. So I do apologize. It's been actually copied and pasted. And can you read it now?
Samira actually can see it. It says, "Markaan qaato talaalka ma af Somali ba wixii liigu sharaxaya liigu sheegaya liigu fahansiinaya."
I think su'aashan waxay ahayd marka aan talaalka aad qaadatay talaalka afsaarka miyaad iska dhigaysaa soo maaha afsaarka miyaad iska dhigaysaa marka okay af Somali baan ku jawaabayaa okay so jawaabtu waa laba qaybood haddeer waqtigeenu taagannahay maadaama ay 22 milyan oo qof la talaalay weli dadkii lama wada talaalin weli coronavirus-ka way nagu dhex wareegaysaa weli bulshadii way ku jirtaa weli dad badan ba dhakhaatiirta jiifa ama guryahooda jooga u xanuunsanaya marka waqtigan xaadirka waxaynu joognaa marxaladii hore talaalkii xog bay u socotaa laakiin si dadka lama wada talaalin faafitaankina weli ma yaraan xayiraadii baynaan weli ka bixin marka xataa haddaad talaalkaaga maanta qaadatid ogow inuu adigu kaa celinaya insha allah markuu difaacaaga kiciyo muddo adigu 2 ilaa 4 week kadib adigu difaacaaga kicinaya oo insha allah adigu kaa celinaya inaad aad ugu xanuunsatid ama aad dhakhtarka lagu dhigo ama aad u dhimatid insha allah boqolkiiba 90 laakiin se weli waa loo baahan yahay inaad afka daboolatid ama sanka aad xidhatid waayo coronavirus-kii waad la kulmi kartaa sankaaga ama afkaaga xaggiisa dambaad ku qaadi kartaa adigoo aan ku xanuunsan ayaad qof miskiin oo nagu qaadsiin kartaa marka dad badan baa weli khatar ku jira ama halis ku jira haddii ay la kulmaan qadar yar oo viruskaas inay aad ugu xanuunsadaan oo dhakhtarka la dhigo waxaa jira weli dad badan oo aan tallaalnay oo khatartaa weli ku jira marka adigu waxaa loo baahan yahay inaanad u noqon qofkii u sidaya ama u soo qaadaya tallaal coronavirus-ka adigoo tallaalan waayo haddaad tallaalan tahay kaama celinayo inaad coronavirus-kii la kulantid ama aad dadka qaadsiisid adigu mu kaa celinaya inuu coronavirus-ka jidhkaaga xoog u sii galo oo aad ugu sii xanuunsatid marka jawaabtu waa ahaa markaad tallaalan tahay weli waad u baahan tahay inaad afsaarkaaga weli xidhatid ilaa ay dadka badankood la tallaalo adigu boqolkiiba 8 wax ka badan bay sheegayeen ugu yaraan oo ay faafitaanku yaraato aynu insha allah ku noqonayno xaaladihii sidaan ahaan jirnay coronavirus-ka hor
Thank you very much.
su'aal baad weydiin lahayd
araalahow su-aashu waxay kaloo leedahay qofka anigu haddii afkii uu xiran yahay qofka asagu afka uu tallaalaya haddaan afka u xirnayn xaq ma u leeyahay inaan ka codsado inuu afka xirto si anigi iyo asagu baan u kala badbaadin
mar walba xaq baad u leedahay inaad dadka tiraadid iga fogaada xaq baad u leedahay inaad dadka ku tiraadid ha ii soo gelinina idinkoon afkiina xidhan xaq baad u leedahay inaad tiraadid qofka intaanad itaataaban farahaaga maydh ama alcohol gelka marso xaq waad u leedahay definitely
Thank you very much, Dr. Samira and Abdul Hafid Chama. There's the final poll, one last questions. We would like everyone who participated on this discussions to answer it. And it will be interesting to see if today's discussions have encouraged people to take the vaccinations or still they are unsure. So there is this questions actually, and I would like to ask, and any one of you guys, any one of the panelists, please come forward and answer it. Can now everyone get vaccinated, even the young people? Are we going to see as well in the futures, like, children having the vaccine, or people in their teenagers, like in the teens? Or is there an age limit to the vaccine?
I think at the moment, there's no data for that category of people. Dr. Samira, people under the age of 16 have not been vaccinated. And we don't, in future, depending on where we're looking at the future coming in, because the way it's going, with doses, we continue to work, we're going to continue to have data coming in, and we continue to have a lot of scientific evidences coming in. And as we go ahead, we might have some thing in place for teenagers and younger adults. But at the moment, we don't have data for them. Dr. Samira?
Okay, I can answer this in Somali, I think, for the interest of time, I think for our audience, if you want me to.
Yes.
But that's a very, very good question. With regards to, okay, af Somali ma ka dhigaya. Waxay gabadhu na weydiisay mustaqbalka qof walba ma loo baahan yahay inay tallaalka qaataan maca ciyaalka yaryar. Marka jawaabtu waxa weeyaan waqtiga aynu taagannahay ma jiraan wax aan caddayn karno in ilmo yar ama wax 16 jir ka yar lagu tijaabiyey. Marka maadaama aan lagu tijaabin wixii 16 sannadood ka yar badanaa haddeer lama siiyo tallaalkan, laakiinse waanu ognahay in hadda ay socoto tijaabooyin fara badan oo ciyaalka lagu eegayo iyo dumarka uurka leh.
Thank you very much.
Sorry, I think I got cut off.
Okay.
Sorry. Tijaabooyin fara badan baa jirta oo ciyaalka lagu eegayo haddeer iyo dumarka uurka leh. Marka ilaa ay natiijooyinkaasi soo baxaan ee la xaqiijiyo ciyaalka iyo dumarka uurka leh lama durayo. Laakiinse mustaqbal ahaan waxaan ku shaqaynaynaa jadwalka ay soo saartay guddiga tallaalada oo u khaaska oo dowladda Ingiriiska ay qabatay. Jadwalkaasi marka hore waxa lagu bilaabay 9 jiradii iyo 8 jiradii iyo kadibna 7 jiradii iyo 6 jiradii oo xanuunka qabay iyo wixii 60 adigu ka weyn iyo haddeerna waxaan maraynaa wixii 50 ka weyn. Marka jadwalka xaggaasaan hoos ugu sii soconaynaa. Waxaa la rajaynayaa samarku markuu dhammaado insha Allah. Waxaa la rajaynayaa samarku hadduu dhammaado insha Allah in dadka badankood wixii 18 sannadood ka weyn ay wada tallaalan yihiin insha Allah. Marka jadwalkaas lagu soconayaa dadka adultska lagu sheegayo ama wixii 18 sano ka weyn oo dhan ba hadda lagu sii socdaa oo sida baahida u kala weyn tahay ba lagu sii socdaa. Ciyaalkana wali laguma tijaabin haddii ay soo baxaan natiijooyinkaas ayaa markaa la arki doona in ciyaalka iskuulka waliba khaasan tagaya in la tallaalayo in kale.
Thank you very much, and Dr. Samira. Dr. Gwenta Carey, one last question. And what do you think needs to be done to increase the confidence and the trust towards, the vaccine, especially among, the Black community? Did you hear the question?
Was that for me?
Yes.
Okay, sorry, I missed that. I do have a child that came in here in the middle. What can be done to build the trust of the Black community with the vaccine? Again, I think it's more open, honest conversations of what to expect when they get the vaccine, what the vaccine is actually protecting them against, understanding the severity of COVID-19 and how the vaccine can help with this and what it means for them long term. I think it's about, building trust between the NHS and the Black community.
Thank you very much. I think we are close to the end of our webinar. I would like to thank you a lot, so much. Thank you to everyone who joined this webinar. Thank you, Dr. Gwenta Carey. Thank you, Dr. Sharifat Mohamed Kamel, and thank you, Dr. Samira Hassan, and a special thanks to my colleague Abdel Hafid and Jama. I hope everyone enjoyed this webinar and found it useful and informative, and then hopefully that made people who were listening to us today to take decisions and, do their research if they still feel like they need to find out more and vaccinate it and get their vaccinations. And soon, but hopefully soon, we will get our life back to normal. Thank you very much, and thank you to everyone. Would anyone would any one of you would like to add anything before we end up the webinar?
Just say something we normally say, I mean, I'm used to is to say, now that we have said this, I mean, people are happy to come to vaccinate. How do you get vaccinated? You get a letter or a note or a text from your GP, or you can go to the NHS website. And if you're not sure, try to speak to one of your leaders, the MOCs, and those people are able to help. Thank you very much for having me. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you so much, Dr. Sharifat. Okay.
I just quickly want to add, thank you so much for this program and this informative session. And I think it's more of this is needed on a regular basis. And alhamdulillah, I think our people are becoming more confident with the vaccine because of these sorts of platforms where they can directly get their concerns addressed and answered. But waxaan dadka laakiinse kula talinaya insha Allah su'aalihiina diibta dadka weydiiya iska ilaaliya waxyaabaha beenta ka dhex socda WhatsApp-yada iyo Facebook-yada insha Allah anaga oo dhan oo ku garab taagannahay dhakhaatiir Soomaaliyeed iyo shuyuukhda Soomaaliyeed iyo dad badan oo community ka shaqeeya sida Council of Somali Organizations iyo dad badan oo community u ololeeya baa idinla taagan su'aalihiina weydiista insha Allah oo isqanciya insha Allah wuxuu waxani inuu dantiina yahay iyo in kale insha Allah kadibna ilaahay tala saarta wa tawakkal ala Allah insha Allah. And thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam.
Thank you, everyone.
Thank you.
Thank you.
Anything before we finish, we wrap up, or you good?
Yep, we're good.
Thank you so much, and from the Council of Somali Organizations, and thank you and Kahia for organizing this event. I truly enjoyed in hosting the panel, and we hope to see more of this from your organizations. Thank you and goodbye.
Thank you.
Thank you.
Very much. Goodbye. Thank you. Bye.